These are your 5 core competency areas for NAPLEX. So area number 1 focuses on assessing pharmacotherapy for appropriateness, effectiveness, safety, and adherence. This area will naturally have a lot of case-based questions to test your ability to collect information, interpret that information, and apply it to safe and appropriate pharmaceutical care delivery. Identifying drug interactions and contraindications. This is going to be about your med safety, your ability to spot when 2 drug interactions could lead to detrimental patient outcome, and knowing how to mitigate those strategies and or identifying it simply. The questions and how they surface in this area could be different. Some may focus on your ability to identify the harm, and others may focus on your ability to mitigate the harm or prevent the harm. The third area is to evaluate lab values and patient data. Again, case-based questions. If you're given labs for a particular patient, your ability to recognize that that patient has hypokalemia or hypomagnesemia, and management of any electrolyte disturbances. What are the electrolyte disturbances that are related in your plan to address them or not? Very important. This is where also monitoring parameters may surface. Patient is on a certain particular medication and you're checking X lab. Is there a need to dose adjust or not dose adjust? Renal dose adjustment. These are all the different things, right? Because this is where your ability to see objective data and know if medications are still appropriate or not appropriate is going to be what they're going after here in competency area number 3. Area number 4 is prepare and dispense medication, ensuring safety and compounding. Expiration date, understanding what is good at certain amount of time at room temperature versus refrigerated versus frozen. This is going to be important. In addition to everything else around good manufacturer practices and flow rates, right? Calculating flow rates, calculating drips. This is going to be where a lot of calculation comes in. Allegations. This, competency area number 4, that's where the math and the calculations going to come in. Number 5, counseling patients, caregiver, and healthcare providers. Communication skills. What are important things that you want patients to know about particular drugs, drug diseases, and drug therapies? These are your 5 core areas that NABP has described in detail on NABP's website. This is where I think you should really start before you open the book so that you understand what each of these areas want, so that when you're studying, you're going armed with that.